Good afternoon. This is Mr. Salas. I'm going to be trying to present some learning how to use the student learning activities for your concepts. I'm going to be presenting only one concept for this activity for today, and is using the student learning activity sheets as a guide to reading, studying, and learning. You have a lot of material that you need to be reading for this course, and it can be very overwhelming many times because we don't know where to begin or how to begin to study for all of these concepts that you have. And I'm only going to focus primarily today on the concept of communication. And so we will be looking at your student learning outcomes in that student learning activity sheet. We will be looking at the pre-class assignments or the required readings for that concept. I'll be looking at the chapters and looking at the chapters' learning outcomes that they have and compare them with what is in your student learning outcomes from your student learning activities sheet. Like I said, and I'm only going to be focusing on one concept today. And hopefully this will help you with all your other concepts for future reading, studying, and learning. So we'll begin. This is what your student learning activity sheet looks like. And like I said, this is the concept communication. And you see that there are 4 columns in here, and they are 4 topics. So you have the concept, which is communication, and it describes things in there, for example, exemplars, pillars, and accusing competencies, which are important for you to become familiar with and to start asking questions in class on how they are related. But the student learning outcomes is what I'm going to be focusing with you today. And all of the student learning outcomes begin with the statement, the student will. If you start looking at your chapter text, your student learning outcomes, it says the same thing. After completing this chapter, you will be able to. So those are outcomes that the student needs to be able to become familiar with and to be able to utilize while they're going through this. And so each one will tell you how you're going to be doing things in the learning outcomes. You see that the 3rd column says classroom activity, active learning, and these are activities that will be happening in the classroom as assigned by the instructor who will be presenting this concept. You also have required pre-class assignments, which basically are your readings from your textbooks. For communication, they use basically kosher and herb, chapter 26, and then chapter 11, assessing the types of interview questions during an assessment. And you also have team steps, which you have been introduced to, and then health language definitions. So when you begin to look at the student learning outcomes, you see that there are 8 outcomes that you must become familiar with, and in them you will be able to explain, you will be able to discuss, you will be able to identify, you will be able to differentiate, and you'll be able to describe. So these are things that you must be able to do in order to be, to help you with your reading, your studying, and your learning units. As I mentioned earlier, I'm going to be going through these processes with the student learning outcomes in this student learning activity sheet and compare them to what your reading chapters have. And so we'll begin with, as I mentioned, these are things we went over this already. It identifies the 8 outcomes that you need to do with the student learning outcomes, and then the required pre-class assignments. So we look at your textbooks and use a comparison here. So what I did is I photographed the first page of your textbooks on communication, the concept of communication. And so you see that it says for the student learning outcomes, which are the course outcomes, the student will. And then it says in communicating, chapter 26, learning outcomes, after completing this chapter, you will be able to. So the first thing that we look at is explaining the student learning outcomes is number 1, explain the basic elements of the communication process. So when you compare it to 26 communicating learning outcomes, it says describe the components of the communication process. So if you look at your chapter and you go and you turn to page 412, you're going to see that it talks about the communication process. Those are the components of the communication process. And you see that it's a sender, message, receiver, and response. So those are the components of the communication process. You also see at the bottom of that key terms, and you see that number 8 in the student learning outcome says utilize appropriate health language. So you'll see that there are several words listed, or groups of words listed, or phrases, and they have pages where you can look at. And if we look at the nursing process for number 1, you'll see that there are some highlighted words, or bolded words, I should say, that are identified as key terms. You see the word encoding, you see the word decode, and you see the word feedback in bold, and it tells you what they are. It defines the word for you. You need to become familiar with wording. As you're going through these chapters, start looking at those key terms and associating those with your readings, because they can become important later on. So we continue to look at the communications, and we discuss the categories of communication. And it says, discuss the various aspects the nurse needs to consider when using the different forms of communication. So number 2 and number 2 in those outcomes are similar. So we look at also in your chapter in 413, and it says modes of communication. So you'll see that you have 3 components of that. You have what is known as verbal communication, nonverbal communication, electronic communication. And so those are your modes of communication. And so it's asking you to discuss the categories. So you need to know what they are and find out what some of those bold words are in there that you need to become familiar with. If we look at identify the elements of professional communication on the student learning outcomes, we can begin to look at things now. It says to compare and contrast therapeutic communication techniques, and we see that it doesn't necessarily talk about the elements of professional communication in those. So we continue for going down, and then we look at discuss how nurses use communication skills in each phase of the nursing process. And then number 10 states, state why effective communication is imperative among health professionals. So that kind of relates a little bit more to number 3 in the student learning outcomes. So you would focus on those areas and look at those. And I think there's almost towards the end of the chapter of communication. It talks about under the communication and the nursing process. And you start looking at the nursing management part of it. But if you keep going further down, you'll see how the communication among health professionals in 431 begins to talk about those areas about the elements of professional communication. Differentiating between professional and social will also be found in those areas. In that area, describe the nursing process related to communication, and you'll see on page 427, communication and the nursing process. Utilize effective communication techniques with various patients. And if you see that in your chapter outcomes, it says discuss the difference between nurse and physician, discuss the major characteristics of assertive and non-assertive, and so describe the disruptive behaviors and how they affect the healthcare environment. So it's asking you to utilize effective techniques with various populations, including nurses. We have to remember that nurses are a group of people, not just patients. So you have discussed team steps communication strategies to ensure safety. You have to introduce your team steps, and you need to learn how to utilize those strategies also during communication. Utilize the appropriate health language. Like I said, number 8 is going to be that one that you have down there in key terms. In your required readings, it was talking about chapter 11, which you said it says to be utilized assessing the types of FMGP questions. So you go to chapter 11, and you look at assessing in your chapter, and you'll see that it also has outcomes for you. Okay, and so you see that it says. Because it's part of it's not part of your learning outcomes, but it's asking you to start looking at the nursing process. And so the nursing process is going to be looking at describe important aspects of the interview setting. So if you look at assessing and you start looking at how you're going to be doing your, it talks about data collection methods in page 163. It talks about the interviewing and why it's important when you're doing an assessment. So remember, communication is part of the assessment data gathering process. So interviewing, and you'll see again that key terms are bolded in these, and so it tells you that these are important terminology that you need to become familiar with. This is that health language that you must become familiar with. Also, I know that these were not assigned to you, but all of you should have them or will need to get these textbooks in the future. And this is the nursing textbooks, A Concept-Based Approach to Learning, and these are all in there. So you have also the assessment part of it in this chapter, and it talks about the interview also. If you look on assessment chapter 34, you will see that the interview process for assessment begins on page 2272. And it talks about, questions to use when we start talking about how to approach the patient to do that. So again, you would be looking at the concept of assessment. It talks about module at a glance about this module. It talks about the concept learning outcomes for this chapter. And it talks the same thing, and it has key concept terms. The same thing is learning how to focus on what the SLOs or the student learning outcomes are presented for you. But if we go to look at the communication chapter in the nursing, a concept-based approach to learning, chapter 38 is concept of communication, and it talks about all these things also. And it talks about the various modes of communication. It talks about the nursing process. And so you need to identify these learning outcomes from the student learning outcomes with the chapter learning outcomes and compare them and focus on those as you're reading material for further studying. Again, the key concepts are related in there because they're all going to be bolded for you to read, and you have to be able to find the word for you in that process. So it's important that you read the chapters and that you focus on the student learning outcomes. It's important that you also learn to read those highlights at the end of the chapter and to use the questions at the end of the chapter to see what you have retained from what you've been doing today when you're studying. You also need to utilize My Nursing Lab and go into what has been set up for the concepts, because the concept for communication will be in there. Do the pre-test and all the activities involved with it, and do the post-test before you do some of the readings and see what you can remember from those readings. Or do your readings now with the student learning outcomes as they are assigned to you, and then go do the pre-test and do the assignments in that, and then go do the post-test afterwards. Remember that this is all how you're going to be learning these things, and it's up to you to utilize them effectively for you. All of you will need to learn how to study new or to change some of those habits, because this is a different way of looking at things and it's a different way of approaching it. The main thing to remember through all of this is that you must learn to think like a nurse. It has to change at the beginning. It has to be reinforced in level 1 because you will need it to all the remaining levels and throughout your career. That you must learn to think like a nurse. What is it that I as a nurse must do to remain legally safe? In other words, can I legally do this? Is it within my scope of practice? Is it safe for me as a nurse to do this so that this patient can benefit from what I'm doing? And if it's safe for everybody else involved, including families, other nurses, CNAs, physicians, and so forth. And is it relevant? The things that I'm asked to do while I am at the bedside, are they relevant for me to be doing these things at this time? So there are three things that need to be asked again. Is it legal? Is it safe? And is it relevant? So just keep those in mind while you're going through your readings and utilize those three statements when you're also taking your tests. And I hope that this will help you in your studying, but you will need to take an active part in learning how to do that. Thank you.